Hey everyone, welcome back. As snowbirds return to South Florida, many are jumping back into their favorite sports like golf, tennis, and pickleball. But after months off, those swings can come with a price. Injuries, so common, especially in aging joints. So this afternoon, we're so glad to be joined by Dr. Brian Hill, an orthopedic surgeon with Palm Beach Gardens Medical Center, to share how you can stay active and pain-free. Dr. Hill, thank you so much for being here. It's scary to think about, but yes, such a good reminder for those snowbirds who are coming back. So let's begin with that. With the snowbirds returning to play sports, what's the biggest mistake that you see people doing when they return?
Yeah, great question. Unfortunately, we see an influx of injuries when everybody comes back down. And I think the biggest mistake people make is thinking they can pick up right where they left off, right? Whether it's pickleball, tennis, golf, people try to jump right back in. But all those activities need to give your body time to adapt. After a couple of months off, your rotator cuff, your core muscles, your stabilizers, they're not ready for the repetitive, high-velocity motions or swings. That's the quickest way, going from 0 to full speed, is really to develop the tendonitis or tears. And so the best way to get back into it is to ease back in. Start slow, short sessions, light swings, and allow your body to adapt.
Definitely important to keep in mind. Anything you can tell us about what kind of warm-up or stretching routine that you would recommend?
Yeah, so a warm-up can make all the difference.
Sure.
Starting with some light cardio, even a brisk walk, really you just want to get the blood flowing. After that, I like to recommend dynamic stretches, not static ones. So arm circles, shoulder swings, cross-body swings, even light band work for your rotator cuff or shoulder blade squeezes. Following this, then really is do light work, and then
yeah, and you know what? Some things too, just to cut you off here, is paying attention to the warning signs, though. So when somebody's playing, is there anything that you want to tell our community members just to pay attention to? Any possible discomfort, let's say? What should they do when they feel that?
Yeah, so a little bit of muscle fatigue or even soreness after playing is completely normal.
Okay.
What's not normal is sharp pain, especially I tell patients if it lingers a few days or wakes you up at night. That's a warning sign. Pain that travels down the arm, if it catches with certain movements or restricts motion, that's often a sign of inflammation or worse, structural injury. The time to visit an orthopedic surgeon or your doctor, I typically tell people, is if it's affecting your swing, that's time to make an appointment, get an evaluation so it doesn't become a bigger problem.
How about surgery? Is that something that is a last resort? But if someone does need surgery, what are the latest advancements that you'd like to share, especially for those elbows and shoulders that you offer at the hospital?
Yeah, so surgery is always a last resort, right? We try to avoid that if we can. But the field of shoulder and elbow surgery is quite exciting. We're now starting robotic shoulder replacements where we're following our hip and knee colleagues where we can preoperatively plan the cases with three-dimensional imaging and then precisely put the implants exactly where they want to be. Hopes are this improves recovery and they get back to their sport faster. Also, with rotator cuff tendons, we're adding biologics, hoping that this helps heal the tendons quicker. The goal is always to get people back to the activities they love.
Of course. Stronger and more confident. It's fascinating to know the advancement of technology and how you can help those patients get back to doing what they love. Thank you so much for being here, Dr. Hill, for talking to us about this, and some important notes to definitely take for those who are visiting here or not, long-term residents or seasonal and they just, came back to town. Something to keep in mind for sure.
Yeah, thank you.
We'll be right back.